So you need to choose at performing a study, analyzing some data, and look at how the test has been done correctly or not when you're looking at data that has been analyzed in a scientific article. So I believe everyone who is not a statistician does need to give some introduction as why they think of themselves as qualified to give a talk on statistics. I think I'm qualified because I have attended loads of lectures on statistics and acquired all the requisite skills to sleep with eyes open, to look interested despite doing that. I have picked up the jargons, I believe, which are required when you want to be looked at as a statistician: test, retest, variability, confidence intervals, and most importantly, don't stop thinking about it, don't stop talking about it, that p-value does not matter, and one needs to look beyond it. Let me now take you to a study that our institute has planned. The purpose of the study is to look at various modalities of treatment of people who are cephalotrichologically challenged, and there are various modalities. 5 modalities of treatment will be compared to the traditional approach. So for those who might not have picked it up, cephalo basically represents the head, and trichological basically means the hair. So cephalotrichologically challenged people are people like these who are challenged at the top. And all of these are celebrities, some of them very successful celebrities. So basically these subjects will be divided into randomized in a double masked trial into one of these groups. The cornea people will treat them with stem cells. Glaucoma department will treat them with bimetoprost drops. Retina department believes Lucentis and Avastin will work here also. Squint will try to do a cover test with something like a wig or something. And oculoplasty believes in the most aggressive intervention, being the only surgical people in doing a scalp advancement and saying that that's the best possible treatment. The control group will be people who keep rubbing their nails while watching a lecture. So at the end of it, we will analyze the results with the help of image J when we compare the pixel density of the hair that is there before treatment and after treatment, as it was seen here before and after treatment with bimetoprost drops. And this will give you the area that was bare or exposed before the treatment and after the treatment. So we'll get a table something like this. All this data is censored because it's not yet been published. So we'll need to analyze it. We'll need to analyze whether the densities or the values before the intervention and after the intervention are different, and how different are they from each other. For which we'll need to understand what data do we have here. Let's go back to the basics a little bit and look at how distributions can be normal and, let's say, non-normal. So normal distribution is typically one that has a bell-shaped curve. So if we look at the center, which represents the mean of the population of all the values here, most of the values will crowd around the mean and will be equidistant from mean. There is no asymmetry in it, very symmetrical bell-shaped graph. Numerically speaking, it's a distribution where the mean and the median are 0 and the standard deviation is 1. The abnormal distribution, or better called the non-normal distribution or the non-parametric data, is one which doesn't have a bell-shaped distribution. The numerical requirements for being classified as normal, that the mean be 0 and the standard deviation be 1, is also not fulfilled. So we have 2 types of data which are either normal or data which is only for the semantics called not normal or non-parametric data. How do we come to know whether the data set that is given to us is normal or not normal? There are various tests which are available through various software and sometimes free online also, where you can see some examples here, which you can just enter the data and it will tell you whether it's normal, parametric or non-parametric distribution. You can draw histograms and see if it actually does form a bell-shaped curve or the curve is skewed towards right or left. A simple way of looking at it is to look at the standard deviation and the mean. So if the standard deviation is greater than 1/3 of the mean, it's probably a non-parametric data. then we also need to look at what kind of distribution you have, what kind of data that you have. For example, the data like age, intraocular pressure, the corneal thickness, endothelial cell counts, these are all numbers which are continuous. They start from a particular number and they are continuously to the most maximum possible range. So there's no break in between. So despite the fact that we can't measure a IOP with Goldman applanation of 14.7, it's actually a continuous variable. The difference comes because only we can't measure it. Similarly, age, corneal thickness and endothelial cell counts are all types of continuous type of distributions. Ordinal distributions are where you can arrange things in order from either the most least severe to most severe disease, most minimal to maximal disruption of the optic nerve function with RAPD, or the least severe primary angle closure suspect to primary angle closure to primary angle closure glaucoma. Or we can have what is called a discrete distribution, where you can clearly delineate all the subjects into one of these two groups, either yes or no. Either the retina is detached or on. Either there is infectious keratitis or there is no infectious keratitis. Either the culture is positive or negative. So these variables are called nominal. However, we have to understand that we can use the way we presented data to our advantage, and a continuous data can be presented as a discrete data and vice versa. Just like these pictures of the same lady can have very two different points of view and represent two different things. So here we can see age presented in the first cartoon as a continuous data in numbers. In the second cartoon, it's divided into three groups of youngest to the oldest, from less than 30 to 30 to 60 to more than 60. And in the last cartoon, we can see it being divided into only two groups. Either it's less than 60 or more than 60. So each data, depending on the way you want to analyze it, can be presented as either of these. However, we should note that some amount of information is lost. So 42 will not be differentiated from 44 if we club them into one category. Either it's 30 to 60 or less than 60. So some amount of information may be lost, but for ease of calculations, this may be done. So basically the variables can either be continuous and parametric, continuous and non-normal or non-parametric, or discrete, which are treated as non-parametric tests, variables. Why do we need a parametric and a non-parametric test separately? Now we know who these people are. You can't imagine the kind of roles being exchanged. But the fact is that Salman Khan is a person who can do all kinds of normal roles, will appeal to a lot of people, but when it comes to the finest or the most difficult of expressions and emotions, he may not be the best person to represent it. Similarly, despite being non-glamorous, having a less of a mass appeal, Nawazuddin Siddiqui probably can entail each and every role in a better way. So a parametric test is something that gives you a more a higher p-value. So it cannot be applied to all kinds of data. It needs to be applied only to a parametric data. It will give you a higher p-value because it's more sensitive and efficient. When you compare it to non-parametric tests, they can be applied to all data. However, the disadvantage is it is not very good at finding a difference. So even if sometimes when you have a small difference, a non-parametric test may miss it. So a golden rule is, if you don't know what kind of data you have, you can apply a non-parametric test, but you may end up with a lower p-value. And sometimes this is utilized by some publications or some kind of presentations where a non-parametric data is there and a parametric test has been done to give a significant p-value, which is actually wrong, when actually there is no difference. So when you go through the statistics textbooks, there are 30s and 50s of pages on what test to choose, and I found it very, very difficult. So I have compressed the entire understanding that I have, simplified it significantly, it may not be applicable to all situations into 2 slides. So first let us look at what the algorithm is. What are the steps of doing it? The first step of doing it is to find the aim of the test. Whether you want to find a difference or you want to find an association. The second step is to look at what kind of data you have. Whether you have a continuous parametric data or a non-parametric data distribution. The number of groups that you're testing, whether you're testing a difference or association between 2 groups or difference in or association in more than 2 groups, 3 or more. And the fourth thing is to find the relationship between samples, whether they are independent samples, the one set of value is never affected by the other value, it's not a before and after thing, or a paired data, that is a before and after thing, or it gets affected whenever the height changes, the weight also changes. So these are not independent variables. The next thing is this table, which you'll get an email of as the coordinator tells me. So you can utilize this table to look at how you do choose a particular test. So we'll go through a workout and let's see how it is done. I want to introduce a very, very serious disease to you, Clostridium difficile Colitis, which causes a large number of deaths in US. No uniformly effective treatment is available, and 40 to 60% of people on the best treatment have a relapse. So what can be done for it? In 1958, someone did a fecal enema, went the other way around to treat such a disease and was successful. Somebody, in fact, went even further and implanted such similar material into the GI tract, the lower GI tract of people, and was successful again. So what was done from it? People learnt and started introducing it as a surgery. So fecal matter from healthy individuals is picked up, stored and implanted into the GI tracts of people who suffer from very serious such disease. So this became a very, very profitable segment and a treatment that was very popular for this rare condition. And MIT now hosts the world's first stool bank, which stores stool from healthy individuals. How can this be simplified? You don't want to do a surgery to cut and implant stool into the GI tract of people. So some people came up with the idea of stool capsules. And a trial was conducted. I don't know which ethics committee gave clearance for it, but a trial was conducted. And fecal matter from healthy donors was converted into capsules and was given to people who suffered from disease that was not treatable with regular treatment. And a lot of people did not have relapses. So let's forget all that. Let's look at this table, which looks into the data that tries to find difference in the populations. People who one treatment with such capsules compared to those who did not. So we, in the first row here that's highlighted, we are looking at age and looking at the 2 groups, one which resolved, one which did not resolve. And we get a p-value, but what test should be done? So here, if you look at the top, we aim to find a difference between, for a data that is continuous. So this is a continuous data, age is a continuous data. And there are 2 groups, both of which are unpaired. And upon applying these findings to this table, we can see that if we want to find a difference, that the test has to come from within this box. If it's a continuous variable, we can narrow down our choices to one of these 8 tests. Now, after applying certain tests, we came to know that it's a parametric variable distribution. So we can narrow down our choices to these 4 tests. And upon the knowledge that these are 2 groups that you want to differentiate, you can narrow down your choices to these 2 tests. And with the knowledge that it's an unpaired data, then choice comes down to an independent t-test. So this is how you can apply a basic, very basic, I don't think you need any special scientific knowledge to reach this conclusion. And we'll have a few more, 2 more examples to make this clear. Now let us look at something like gender, male or female. So basically the answer to the question that whether the person is male is yes or no. So it's not a continuous data, it's a categorical variable. Everything else remains the same. We want to find a difference for a categorical variable between 2 groups for data that is unpaired. So let's apply the same understanding to this table. So we want to find a difference, 8 choices, for a variable that is categorical, 4 choices for finding a difference between 2 groups. We come down to 2 choices, and with the final understanding that this data is unpaired, we can reach the test that we need to apply, the chi-square test or Fisher's exact test. This is the test that we need to apply for calculating the p-value for this test. We will all get an email of this presentation, so we don't need to take photographs. Am I right? Yeah. So let us look at another study where they did a study to take out the lens fragments that were retained after cataract surgery on same day and compared it to a pars plana lensectomy that was done 1 week later. And we will try to find out the difference between the 2 groups and for these 2 variables. So if we look at the same day surgery and try to compare it to pars plana vitrectomy, let's try to compare the first and the last 2 groups. So what we want to do here is to find a difference for continuous variables for groups which are more than 2. So there are 3 groups here. One is same day PPV between 1 to 7 days, and the last group of people who had vitrectomy after more than 7 days. And we want to find a difference between these 3 groups. And these are all unpaired data. So let us apply this understanding to this table. We want to find a difference between data that is continuous and the distribution is parametric as tested by some specific parametric tests, and the groups are more than 2. These are unpaired data, and so now we can reach the conclusion that a one-way ANOVA should be applied to test a difference between these 2. So if I can, anyone can. If you have this table with you and you can find an answer for each of these subsequent questions and have this table printed with you, you can find the test or look at whether the correct test was done in an article or not. I think we'll have some time for discussion at the end of the talk. I'll